Day today, Kenyans have the opportunity to reflect on the successes of the initiatives by government, communities and individuals to combat the virus. Speaking at an international function in Gusii Kisii County, attended by different dignitaries, First Lady Margaret Kenyatta has warned the society on stigmatizing the HIV and AIDS victims, but instead show them some concern. Here's Elpina Nyambu.
The First Lady said that Kenya has made significant progress in reducing the transmission of HIV. This has been made possible by the investment in resources and access to treatment, which has been made possible by the united conviction and the sacrifice of families and communities to fight this global pandemic.
Kenya has made significant progress in reducing the transmission of HIV. This has been made possible by investment in resources and access to treatment. This has also been made possible by the united conviction we have that the sacrifice of families and communities to fight this global pandemic.
Health Cabinet Secretary Gusii Kisii also spoke during the event, commended the First Lady for her Beyond Zero initiative, which she said has done a major impact on reducing mother-to-child HIV infection, and called on stakeholders to capitalize on the gains made to completely eliminate mother-to-child HIV transmission of the virus.
The fact that resources for HIV/AIDS response have either flattened or in some cases reduced significantly in recent years. However, I'm happy to note that my ministry has received over 50% increase in funding over the last 2 years to address these responses, among others.
Meanwhile, over 5,000 people in Baringo living with HIV and AIDS, with new infection being among the youth and adolescents who are actively in sex. Kenya has the joint third largest HIV epidemic in the world alongside Tanzania, with 1.6 million people living with HIV in 2018. In the same year, 25,000 people died from AIDS-related illnesses. While this is still high, the death rate has declined steadily from 64,000 in 2010. Statistics according to UNAIDS data 2019 show that HIV and AIDS in Kenya, 1.6 million people living with HIV, 4.7% are at a HIV prevalence ages between 15 to 49 years, 46,000 new HIV infections, 25,000 AIDS-related deaths, 69 adults are on antiretroviral treatment, 61% children on antiretroviral treatment. Although awareness of HIV and AIDS is high in Kenya, many people living with HIV face high levels of stigma and discrimination, which prevent people accessing HIV services. Elpina Nyambu for KUTV.